Do you experience any severe bone pain at night which usually gets relieved only after painkillers? This can be due to a condition called osteoid osteoma occasionally. Hello everyone, I am Dr. Arjun Lokesh, consultant interventional radiologist, Chennai. So what is osteoid osteoma? Osteoid osteoma is a benign non-cancerous bone tumor which usually comes in young age patients, sometimes even in children between 10 years of age to up to 35 years of age. These osteoid osteomas, also known as benign bone tumors, can affect thigh bones or leg bones, or sometimes your backbone, which is known as spine, or even any bones for the matter. Why do these osteoid osteomas cause severe pain? Because these osteoid osteomas have a central area known as nidus, which secretes some chemicals known as prostaglandins, which usually causes severe pain, especially at night. So how do these patients come to us and present? These patients usually complain of severe pain at some part of their body with severe bone pain, especially which comes at night, and usually requires pain medications to be relieved. This pain can be very severe that it might also affect the mobility of the patient and the quality of his life. So how do we diagnose this condition? Usually we require imaging such as X-rays or CT scan or MRI of the legs or the thigh or whichever part is affected to know exactly what is the condition which has caused this pain. So if we get to know it is osteoid, either a CT scan or MRI scan is usually performed, because these scans help us to exactly localize the nidus of the tumor, which releases the chemicals leading to pain. So what is the treatments options available? Before, in the traditional time, we used to do surgery which removes a part of this bone for pain relief. But nowadays, with the modern treatment, we don't require any major surgery, and with a small pinhole sized needle, we can easily treat these tumors. This minimally invasive procedure is known as radiofrequency ablation. Radiofrequency ablation involves placing a small needle inside the center of the bone tumor, and heat energy is delivered through the needle. This will burn out the tumor and will cause instantaneous pain relief. This entire procedure is usually done under spinal anesthesia, which will numb any pain below the abdomen. And this procedure is usually carried out as a daycare procedure, or at the max it might require 1 day admission, and you might return to your workplace very soon after this treatment. So the take home point is, whenever you or your loved ones are suffering with severe bone pain, especially in young patients, it can be due to this rare condition called osteoid osteoma. So do not neglect this and get a proper imaging done for an early diagnosis. Minimally invasive procedures like radiofrequency ablation can be very painless and will provide you an instantaneous pain relief.